Hello, my name is Dr. Karim Kurji, York Region's Medical Officer of Health. York Region is making tremendous progress in vaccinating our most vulnerable population and those most at risk of acquiring COVID-19. Residents of long-term care, retirement homes, and congregate living settings, and the Chippewas of Georgina Island have been immunized. Last week, we began immunizing York Region residents age 80 plus, while continuing to immunize healthcare workers in the highest and very high priority groups. York Region, with its hospital, community physician, and municipal partners, have immunized 35% of York Region's 45,000 residents age 80 plus so far. Vaccinations will continue at the 5 York Region clinics this week. We were pleased to open an additional 3,000 appointments today at 8:30 a.m. for Richmond Green and Georgina Ice Palace. Appointments will be for Tuesday, Wednesday, and Thursday of this week. While we know the road has been a bit bumpy, and we do apologize for that, we continue to make changes to improve where we can. For those who have been able to get an appointment, we remind you, be prepared to spend between 60 and 90 minutes from the time you arrive at the clinic to the time you leave. Please plan and prepare accordingly. Residents and support persons will move through a coordinated flow process at the clinic, which may require a fair amount of walking. Please do not arrive more than 10 minutes prior to your booked appointment spot. If you arrive too early, you may be asked to leave and return closer to your appointment time. For those who are eligible and have not been able to book an appointment, I assure you more appointments will be released as soon as we get more vaccines in York Region in the next couple of weeks. As a result of no-shows and/or cancelled appointments, a small number of appointments may appear through the online booking systems. We encourage you to check back often at york.ca/COVID-19 vaccine. Further increased supply is anticipated as of March 22nd. York Region Public Health will look to open additional vaccination clinics at that time. In very good news, Health Canada has now authorized a fourth COVID-19 vaccine, the Johnson & Johnson vaccine. We currently do not have confirmation on delivery of either AstraZeneca or Johnson & Johnson, but we look forward to direction from the Ontario government. Please know we are working very hard on finding ways to reach York Region residents age 80 plus who are homebound and cannot travel to a clinic. Again, we currently have very limited supply, and the Pfizer and Moderna vaccines have very strict cold storage and transportation requirements. We have not forgotten about anyone. We continue to follow the prioritization guidance from the province and work with our partners to reach all our residents as soon as we can. Last week, the province announced the details of Phase 2 of the vaccine rollout, which is expected to begin in April with a focus on vaccinating populations based on age and risk. Phase 2 includes older adults between 60 and 79 years of age, individuals with specific health conditions, people who live in hot spots with high rates of death, hospitalizations, and transmission, and certain workers who cannot work from home. You can find details about Phase 2 on our website and on the province's COVID-19 website. We know residents are anxious and eager, but we ask for your patience as we immunize those who are most vulnerable and at highest risk of acquiring COVID-19. We will continue to communicate with residents when it is their turn. When it is your turn, we encourage you to get vaccinated. Health Canada only approves vaccines determined to be safe and effective. All the authorized COVID-19 vaccines were tested on a large number of people through extensive clinical trials and have met the strict requirements for approval, including safety. The vaccines cannot give you COVID-19, and they do not change your DNA. Vaccines are the best way to protect you and those around you from serious illnesses like COVID-19. In the meantime, it is important everyone do their part and continue to follow all public health measures. Due to increasing difficulty getting information on close contacts, I have introduced a Section 22 class order directed at York Region residents. This requires all residents to cooperate with public health if they have been diagnosed with or have symptoms of COVID-19, are expected to be self-isolating, or are a close contact of someone diagnosed with COVID-19. We had previously tried to do contact tracing through cooperation, which has been our traditional approach, but we need to move further and ensure we have all the necessary information to keep all cases in check. We've also issued a letter of instruction directed at workplaces. This emphasizes the use of best practices and supports the vaccination of staff when it is their turn. More information on these two orders can be found on our website at york.ca/COVID-19 under the Enforcing COVID-19 Regulations tab. Stay vigilant and stay safe. Thank you.